my name is Taylor Holt. I'm a Doctor of Nursing Practice student studying to be a certified registered nurse anesthetist. My DNP project includes comparing microbial cross-transmission between a single gloving approach and a double gloving approach to anesthesia induction.
Objectives for this presentation include identifying a method of hand hygiene that can be done within the anesthesia workstation quickly and effectively, identifying high-touch areas within the anesthesia workstation, and comparing microbial cross-transmission when utilizing a single gloving versus double gloving technique to anesthesia induction.
So I'm going to demonstrate a single gloving approach to anesthesia induction. I've placed an oral pathogen, a simulated oral pathogen, in the patient's mouth to demonstrate spread of the pathogen throughout the anesthesia workstation. So we're going to go right into direct laryngoscopy. I'm going to take my blade. I'm going to use my fingers to open the mouth as wide as I can to get the best view possible. And inflate my cuff. Take my circuit off and pop it on the tube. And then I'm going to ventilate the patient.
A lack of standardization of infection prevention policies, the nature and intensity of care provided by anesthesia providers, and an absence of hand sanitizer within the workstation have all been cited as reasons for a lack of hand hygiene practices among anesthesia providers.
So I now have 2 pairs of gloves on, and we're going to go through an induction sequence where I'm using the double gloving approach to see how many of the oral pathogens will transmit over to the workstation. Again, I place my hand in the mouth to get my best view. Once I have my view, I'm going to place my tube again. Start pulling my stylet. And now I'm going to remove the outer pair of gloves. I'm going to inflate my balloon. Connect my patient. Ensure chest rise and condensation of my tube and end tidal.
The highest risk of bacterial spread is during induction due to the highest frequency of contacts with the patient and the anesthesia workstation. The most frequently contaminated sites within the anesthesia workstation include the APL valve, the vaporizers, the top of the anesthesia machine, and the reservoir bag. Pictured here are the results of the comparison between the single gloving approach and double gloving approach to anesthesia induction. The bright white underneath the black light represents the oral pathogen that was placed in the mannequin's mouth during these demonstration videos. The anesthesia machine was cleaned between each induction sequence to best represent transmission of the oral pathogen. The biggest differences were found upon observation of the reservoir bag, the APL valve, and the end of the circuit, but the comparison between the 2 approaches was rather extreme. Thank you for watching this video, and I hope to have presented a little perspective on a hand hygiene method that can be performed quickly and effectively to prevent microbial cross-transmission among anesthesia providers.